Mental illness has always been a mystery in its diagnosis and treatment methods throughout history. Few notes in an ancient Egyptian document called the Papyrus of Ebers seem to describe the affected situations of concentration, attention, and emotional distress. Some of these states were later described and called hysteria and depression. The treatment was somatic. Treatments included applying bodily fluids while performing magical spells. For instance, they used the principle of transfer in their medicament to get rid of migraine. The aching side of the head was rubbed with the head of a fish, to transfer the pain from the head of the sick to the head of the fish, using the fish somewhat as a scapegoat. In ancient India, the factors of mental illness suggested include inadequate diet, mental shock because of too much fear or joy, and defective body activity. The use of herbs and ointments, charming and prayers, and moral or emotional persuasion were included in treatments. In ancient China, the first known record of mental illness dates from 1100 BC. Mental disorders were treated mainly under traditional Chinese medicine using herbs. Acupuncture, the insertion of very thin needles through skin at strategic points on the body, or emotional therapy. The ancient Chinese believed that devilish possession played a role in mental illness during this time period. In ancient Greece, many were divided over what they believed to be the reason of the mental illness that a patient faced. Some believed it was the punishment of the god, while others believed it to be caused by a physical problem. This led to many variations of treatment ranging from prayer to surgery. Some ancient physicians didn't understand what part of the body was responsible for the strange behavior and turned to prayer and forgiveness from the god. However, most physicians understood mental illness was often caused by physical ailments. Hippocrates was a physician that believed that the brain was the center of thought, intelligence, and emotion. Because of this, he and many others came to the conclusion that mental disorders came from problems with the brain. As time went on and physicians began to better understand mental illness, they began to treat patients in different ways. Physician Celsus argued that insanity is really present when a continuous dementia begins due to the mind being at the mercy of imaginings. He suggested that people must heal their own souls through philosophy and personal strength. He described common practices of dietetics, bloodletting, drugs, talking therapy, incubation in temples, exorcism, incantations, and amulets, as well as restraints and tortures to restore rationality, including starvation, being terrified suddenly, agitation of the spirit, and stoning and beating. Most of the patients, however, did not receive medical treatment but stayed with family or wandered the streets, vulnerable to assault and derision.